Hi, hello, and welcome to another episode of Just Curious Relationships. As always, I'm your host, Megan Holmgren, and today we are joined by licensed marriage and family therapist Margaret Doherty. Hello.
Hello.
Along with Dr. Helena Roderick, supervisor psychologist working with LGBTQ populations for Northwell Health.
Hello there.
Welcome, ladies. Thank you for coming.
Thank you for having us.
Margaret is apprehensive on this last day of recording. Okay. Dr. Roderick, as I was kind of explaining before we started recording, what I have done here is scoured the corners of Reddit to find a prompt, and I have it here in front of you, face down. This is Margaret's favorite part of the episode. Oh, yeah. So you guys can flip them over now, and I'll read them, and we'll get into it.
Okay.
My 28 female husband, 30 male, of 8 years, keeps making remarks about our, quote, gay child, and I'm livid. My husband has taken to making comments about how our 1-year-old is gay. Whether it be saying that specifically, or taking on an effeminate tone and lisp when talking to or about him, or gesturing like a wrist flip. I don't know if a person is already gay at birth, if they become gay, or some combination of the two. Furthermore, I couldn't give a flip-flopping F what his sexual identity turns out to be. What I don't want is my son being confused, hurt, or manipulated by offhand distasteful comments made by his father. If he is gay, wouldn't he feel mocked overhearing or remembering this shit? If he isn't, wouldn't he feel ashamed? His father's commentary isn't needed either way. I, for one, do not believe that my 1-year-old son's enjoyment of feeling or wearing silky blouses of mine are a testament to gayness, nor his penchant for shiny things, usually jewelry of mine, nor the fact that he coos like a dove. He's not learned to talk yet. This is how his baby talk sounds. Nor that he loves pink and will fight his sister over her crocheted baby blanket. Nor that he is in the 10th percentile for his age, very slight and daintily, but built. It doesn't help that his sister is huge, very aggressive, loud, and sporty at 5 years old. At first, I treated these comments like a joke, but they now occur several times a week. My husband has also mentioned that we won't get any grandkids at this rate because our daughter is shaping up to be a lesbian. But he doesn't keep revisiting these comments toward our daughter. My husband keeps saying I am overreacting when I tell him to stop. He's gone to drag shows with me. I have gay and lesbian friends, though lesbians far outweigh the gay men. My husband is cool with them. He's never acted homophobic. He's been hit on by gay guys and turned them down without hostility. I don't know why the obsession with our son's behavior. TLDR, husband keeps pointing out behaviors in our 1-year-old son that, if he were to be a grown man, would lead others to label him as gay. At first, I treated it like a joke. He made these comments about our daughter, too, who is a tomboy, but he's not letting up and it's starting to royally piss me off. Should I lighten up and hope it dies down? If it's unacceptable, how should I make sure the comments stop?
Well, that's a loaded one.
Yep. I did warn you, Margaret.
You did.
saved the biggest one. So, to start, what are both of your initial reactions to this?
I don't think I can say my initial reactions to this. I think that as a couple, right? So right off the bat, as a couples therapist, they're not communicating effectively. He's not hearing her. I mean, that's just like basis line without even going into the content of what is going on. And then there's the parenting piece. See, even I'm a little lost for words this time. I mean, I'm going to look to you to see if you have an answer because I actually can't. And because usually, when you're in the therapy room, you don't get all this at once like this.
It comes out over time.
Or you have an idea, not like Megan surprising us.
So what this first prompted me to think about is about the wide variation in sexual orientation, in gender expression and presentation, and that's the kind of discussion I would want to have with this family is just that there is no box in which you put sort of all the male behaviors and a box for all the female behaviors. So that's just what jumps out at me as someone who works with LGBTQ young people and really LGBTQ identifying people of all ages, is this man seems to be approaching things in a very binary way.
Yes.
And I feel like there's a need for some education around the full spectrum and the full continuum.
Absolutely. And I think I'm looking and I'm reading this over and over, like the things that she's identifying that he identifies, to me, like I would never look at that and be like, oh, that's gayness. Like it's sensory, it's feel, it's touch.
Especially for a 1-year-old.
Right. And like the sister's blanket, I think it's just that it's the sister's and not his. It has nothing to do with the fact that it's pink.
Right.
So I think that's where I'm getting the hard time reading it, because I'm like, I would never think any of that for a 1-year-old or even like really anyone.
Yeah.
Like,
and in fact, there was a time historically where pink was a traditionally masculine color. So it's, in our society now that it's sort of interpreted as more feminine, but that has not always been the case. So even that color pink, like inherently, there's nothing feminine about it.
I didn't realize that, actually.
Yes,
That's
yes,
interesting.
indeed.
I love my fiance in pink.
I will say I'm not so old, but I can remember a time when some of the things she's saying were the kind of like
Stereotype?
Yeah, stereotypically held views of what she's saying gayness might look like. That doesn't mean it ever has actually been what gayness would look like. But I can remember a time, and it just seems like he has these kind of very like outdated views.
Right. I want to say teens today maybe would call that like old school or whatever.
So I know we'll definitely get more into the kind of LGBTQ plus aspect of this way more. But before we do, I did sort of want to first dive in, and Margaret, to your point, like there's a dynamic going on here between mom and dad. It sounds a lot like there's hurt here, maybe some thinly veiled, maybe it's a stretch to say hate, but definitely prejudices. What can that do to that relationship? And what can it do even more so to a parent-child relationship if that's being directed towards their children?
Well, if this can, I mean, the kid's being traumatized, right? Like over and over and over again. The 5-year-old could be traumatized by it over and, a 5-year-old definitely understands way more than a 1-year-old.
Yep.
So if the 5-year-old is overhearing this stuff, are they going to look at it as a negative? Or if that 5-year-old is identifying more male than female, well, I can't tell anybody this because they're saying all this about my brother. Like, there's no way that I could say anything.
Well, and it seems like he's made comments about his 5-year-old.
Yes.
Not with such frequency, but they have been made. And that was the next point I was going to get to. I think as we've been spending too much time together, but, their daughter is 5. And, I have a 3-year-old. She's a little sponge. She hears everything. She understands way more than before I had kids I would have ever thought a 3-year-old could understand. She understands, context and conversational cues and stuff like that. So if he's saying this to her, whether it's about her or her brother or anywhere where she can overhear it, what is that doing to a child? I'm sure, the focus here is on the 1-year-old, on the son, and I'm sure there's a lot that we could dive into and like what that does to him and what it would continue to do growing up if the behavior isn't changed. But she's old enough to understand now.
Yeah.
So what is that doing?
She's probably hearing more than they think. Like, I remember when I was a kid, I would like, your parents are sitting at the kitchen table, your ear is like really listening to what they're saying. And 5-year-olds are smarter now than when I was 5. I mean, it's modeled behavior, right? So then is she going to go out into the world, and if she has a classmate that has like a blanket that's pink or that is wearing a silk shirt or whatever it is, then start to identify them in that way and insult them. Right? Because...
Or to her brother.
Or to her brother.
Yeah.
And mom says, she tells him to stop. But I wonder how much mom tells him how much it hurts her. Right? Like, and going against the behavior and saying to the dad, I don't want you to do this. Why are you doing this? You're so mean. Is going to make him defensive, right? Stop overreacting. If she says to him, hey, this really upsets me that you're speaking about our children in this way, that you're speaking about gay or lesbian in this way. All of this makes me feel really uncomfortable because of my values, right? It comes down to values.
Yeah.
And she says, you know, he's been hit on before by gay men and like it's no big deal. And sometimes for people who have trouble in this area, it's different when it's in your own home. Outside the home, fine. In my home, my own children, my own family, different story.
Yeah. And that's one thing I wanted to ask both of you about is how common is that in, you know, your professional experiences of seeing someone who might be, maybe we'll stop short of saying an ally to this community, but at least accepting of or can coexist peacefully without like raising a stir. But then when it is in their own family, they have very sort of, you know, rigid and perhaps worse views on what that means and how they view that person in their family.
So I was just going to offer that certainly there's all kinds of unconscious biases that we can carry with us. And so, yes, there's very like overt behaviors that the wife can identify that are like not problematic, but we're certainly getting a lot of information here about what's going on inside this man's head. And as you said, when it comes to his family. And I think that points to kind of the deeper sense of how he truly deep down feels about the population.
Yeah. So to both of you then, because I feel like there might be some crossover a little bit in the types of work that you do, but still different enough that maybe your answers might be a little bit different or complement one another. If this woman came into you and unloaded this post basically onto you, how would you counsel her? What would you say?
I would first validate her experience and say that it was extremely difficult and that it's good that she's asking for support outside the house, outside friends, family, people who know the situation. And probably a lot of education too for her, and then maybe education down the line she could share with her husband. I would, if I was seeing her individually, I would say maybe couples therapy to kind of talk about this, and then maybe even down the road, they might keep an open mind to family therapy if one of these children tend to identify, right? Like if that happens as they identify as gay, lesbian, transgender, whatever it may be, that they get support around that together because that is going to be challenging. And I think even if dad can work to acceptance, right, and love and all of that, there will also have to be grieving, right, around what he thought his life would be like with his children. And that's not to say that he won't love his kids and accept them, but there is that other side of it of like, oh, I thought this was going to look this way, and now it doesn't, and I just have to process that.
Yeah, I definitely, sorry, I'll let you go in a second, but I could definitely see, and I don't personally share this view, but I could see someone who maybe had this very heteronormative view of what their child's life would look like. And if they're having to reconcile the idea that that might not actually be what their child's life will look like, that's something that you might grieve, you know? And I know there's a lot that goes into that. You know, it could be an inherent fear of challenges that they might face in their life or biases or bullying and on. But if this is kind of the tone that's being set at home to start, it's not really getting off on the right foot, I think.
Yeah, and I think a very therapeutic approach would be to certainly, as a therapist working with this family, know that fear may be driving a lot of these behaviors and also lack of knowledge. Yeah. And so I think, you know, should you be interfacing with this couple or with this family unit, like coming from that point of understanding where perhaps dad might be coming from rather than just leaning into the anger that might be very natural to feel towards this dad. But yeah, I would certainly do, as we discussed, a lot of validation if I was meeting with mom alone and hearing these kinds of things, really unpacking the education. And so I don't know that she can kind of make sure the comments stop, which is kind of how she phrased her wish. Yeah. But kind kind of working on setting expectations for like a dialogue and for helping him understand the consequences of these kinds of choices that he's making. That, certainly if the 5-year-old is a sponge, is going to observe these things, is going to perhaps interpret certain messages as it's not safe to kind of express myself within this family. And that could certainly snowball down the line into all kinds of challenges. Yeah. And then should this kind of dynamic persist with this 1-year-old son, like, again, just the challenges can sort of snowball. So really starting to unpack things with this family and empower them about how can they choose to communicate in a healthier manner. Can he be open to understanding that there's all sorts of normative behaviors for his son, and that honestly, should his son choose to have a gay sexual orientation, like maybe that's not the way to communicate around his son's gay sexual orientation.
It could also ruin the marriage, right?
Yep.
She could get to the point where she says, like, I'm not staying, I'm not subjecting my children to this, we're gone.
So, I was going to save that one for later, but we'll get into it now then. That thought occurred to me, right? Because I'm definitely not someone who knee-jerks into, like, you got to leave, get out. But in this one, that honestly was my knee-jerk thought. And it probably is partially coming from a place of being a mother. And, like, I would do literally anything to protect my child. And I can imagine that at some point that, that instinct is going to kick in for her too. But can she get the behaviors to stop? Because as much as it might be we're gone, that's not, it's not as easy said. Like, he's still going to be a part of their life in some capacity, short of her like going Gone Girl on him,
right?
With her kids in tow, which would be a much larger issue, I think, for her and all of them. He's still going to have a presence in their life, and so her maybe removing herself from the marriage, and sure, maybe she gets majority custody, and he sees them on a less frequent basis. If he's still making those comments, they're still, I would think, going to have a damaging impact on the children. And maybe as they're growing up, they can kind of reconcile that with therapy or with whatever else to say, I am who I am, my mom accepts me and that's great. And my dad's kind of a jerk or maybe more than a jerk, but I'll be polite here. But like, can she just pick up and move? And would that really change? Or is there other ways to, I guess, try to course correct this?
I would think expressing how she feels, not just don't do that, it's wrong to do that, don't say that.
Yeah.
Trying to work with him and educate him, right? Also, there's what did he learn growing up? What was his family's dynamic like, right? Like, it all spreads out. It's not just this dynamic. So, like, looking at what did he learn? What did he grow up with? How did his parents view it? His family? Not to say that it's right, it's modeled behavior, though. And if we can understand at least where it comes from, where it starts, then we can look at being aware of it and process it. He may actually think that these comments aren't offensive.
Yeah. Right.
He may think he's joking around, it's ha-ha funny, and it's not, and he's not clicking to that because maybe his parents or his family joked like that. And maybe even joked like that to somebody in the family that was gay, right? And they were like, all right. And that person didn't say, that's offensive, please don't say that. So he may think it's normal, quote unquote normal.
Yeah.
Well, and that's where the mom's feelings are so critical, that she's explaining, this hurts me. I feel sad, I feel upset. And so that it's not about right or wrong, it's about, look, this has a significant impact on me emotionally. We are in this partnership together, like, can we have a space of like respecting that these are my values? And as you said, like, it would be super interesting to understand, like, this man's history in terms of, toxic masculinity and so on. Like, how did he become this person who is imposing these views on a 1-year-old who is interpreting fairly innocuous behaviors and putting this label on them that is wholly unnecessary for a 1-year-old?
Yeah.
Yeah, I mean, he's one. He doesn't know what anything is.
Yeah.
Right. He coos like a dove. He's baby talking.
Right, he can't even talk.
Right. He's not telling us what his sexual orientation is.
Yeah. Right. And he may know deep down inside him what that is, and when he can speak and he can express that, okay, then we have to talk, but he's one.
Yeah. We've sort of have a sense of what I think the answer will be, but we've talked a lot in previous episodes, Margaret, you and I, about maybe picking battles, picking the right approach into things, maybe looking more inward in certain cases. I feel like in this one, I don't know that she needs to do a whole lot of inward, kind of introspection. But is this one where we pick the fight? This is the fight to fight?
This would be the hill I would die on. Yes, absolutely. And I think most moms that are feeling the way that she is feeling would decide that this is the hill I'm going to die on, right? Like, this is not something she's going to be able to say, like, okay, this is just who he is and I'm not going to try. I'm not going to just turn my head. Like, she's absolutely not going to let this one go.
Yeah.
And I don't think she should.
And I would think of it in terms of like escalating assertive behaviors, so it doesn't start out, hopefully, in an aggressive kind of confrontation, but these I statements about her feelings and sort of see where it goes from there.
And actually we've talked a lot about, getting educated herself and then being able to incorporate that into conversations. I'm a little curious how he'd react even to the I feel statements, which, I mean, I'm a big fan of those as a tool, but
they're tough. I think just having like a softened startup of the conversation, right? Like, this is not a conversation you're going to have after he makes the remark, right? Because mom is going to be emotionally charged. She is going to come out harsh right away, understandably so from her point of view.
Yeah.
This is, we're watching TV on a Saturday night, we're calm, we had a great day. Hey, can I talk to you about something? There's been something that's really been bothering me.
Yeah.
Because if she goes at him, he gets defensive. He's not listening. He's like, all right, she's judging me, right?
Right. So that the knee-jerk reaction, if you're confronted, is then going to be to formulate your defense. And then you don't even hear what's being uttered to you, really. You're just in your head formulating your defense. Yeah. And honestly, I don't know him as a parent aside from what's here. So even if she can have some gratitude in her heart and her mind and verbalize some of that to him about something he does right in his parenting, butter him up.
Right.
And then really start to unpack this big issue.
Yeah, because I think that I can imagine there's other dynamics within this relationship where communication is an issue. This is the one that's like making it blaring in her face that he's not hearing me.
Yeah.
And he's hurting me and potentially hurting both of our children.
So to that end, I will say that there, at least in me trying to do some research for this episode and prepare for it, there's not a whole lot of research about, parent interactions in an age group quite this young as it relates to negative and positive and the correlation. It's a lot more about teens and that kind of adolescent population. But to caveat this next bit with that, I found some statistics, and it's worth, I think, just putting out there so that people can understand, because we've talked about a decent amount so far about how this could be harmful to the son, to the daughter, to both of them, to their relationship. There was a study that I found that said family rejection is strongly associated with mental health problems and suicidality, substance abuse, and sexual risk. It goes on to say, youth with highly rejecting families are often forced to leave the home, leading to overrepresentation of LGBTQ teens in the homeless youth population and foster care system, thus exposing them to more kind of risky contexts. For example, and a decrease in practical and tangible support from parents can lead to increase in certain HIV risk behaviors among young gay and bisexual men. It's also been linked to an increased rates of depression, as I said, suicidality, substance abuse. And they did say, which I thought was very convenient for my research for this one, it's less clear if the presence of one supportive parent is enough to buffer these negative impacts of having an unsupportive or a rejecting parent.
So in general, the resiliency literature, going back to like the 70s, so across the decades, will kind of make a blanket statement about having one person, one ally is like going to make all the difference for you. That's a very general statement. When we're talking about these kinds of families, I think it is very complicated because we're not just talking about having an ally and someone neutral. We're potentially having an ally and someone who's overtly making rejecting, traumatizing kind of statements. And that's something very different.
Yeah.
So, yeah, I think it is so helpful that you brought those statistics and those different sequelae up. It's super helpful for people to understand that we're talking about some very serious matters.
Yeah.
And hopefully that can empower certain family members that you have a voice, you have a role to play in your teen, baby, child, whatever, in their life. You have an important role. You have power. And I think certainly for the parents of the teens, they lose sight of that sometimes.
Yeah. I guess, and you sort of nodded to it, but one of the questions I have from those statistics, because they're very jarring, they're very serious, and it's not light subject matter, right? When this happens. But to the point, a lot of them are how to talk to teens or talk about teens and the family dynamics with LGBTQ teens. Is there an age where all of these risks kind of start being more present? Not to keep bringing my daughter up, but she tells me, I'm a big kid when I'm 7. So is there a hard number that here's the age where all of these things really start, they might have a little bit of an impact beforehand, but it starts really piling on, say at 12 or 13, or is there a number to it? Or can the presence of a rejecting parent or parents be damaging at any age? Say 1 in 5 for the context of this one, and maybe even before the child realizes their own sexual identity or orientation.
Yeah, I mean, I think it can be so damaging even early on. I think certainly as we approach middle school and the teen years, there are major red flags when we're talking about these kinds of rejecting behaviors, absolutely. But, depression can be seen in children, not just in teens. And so, yes, the prevalence numbers for self-harm, for depression, for substance use, of course, have a real spike in those middle school and teen years. But things can be very harmful way before that. So I wouldn't sweep any of this under the carpet just because we're talking about little ones, not at all.
And I think sometimes the parents don't realize the resources that are out there for them, for their kids. I used to work at one of the runaway homeless youth shelters in Nassau County, and we did get a lot of LGBTQ kids that were running from home because either their parents found something in their rooms or they came out to their parents. And really then, you get one side of the story from the kid, and then sometimes you get on the phone with the parent and they're like, we definitely were reactive, but we want the child home, and they need resources. They need help. They knee-jerk react. The child goes, I'm leaving, right? Or goes to the school counselor, and the school counselor, helps them get somewhere safe. And then when the parents can get on the phone with someone, they can say, all right, talk to me. Help me understand, where can I go? What can we do? We don't want this to be the outcome. Yeah. We reacted poorly in the moment.
Yeah.
And that's where I really encourage that regardless of whether you fully understand about sexual orientation or gender identity or expression or whatever, can you pause and just let your child know, I love you no matter what. I accept you for who you are. And then, maybe it's going to be a journey, and maybe there will be grief and loss and all of those things. But conveying that love to that child is essential. And then everything can go from there.
Do you think that there's power in acknowledging that grief to the child or, to the person in your life who's saying this? In this context, we'll go with child because I think that kind of parent-child dynamic is a little bit stronger than maybe a friend or a cousin or something. But can you say I love you as you are. I love you no matter what, and I accept this about you. It's going to take me a second to get to a place of comfort with this, because it brings up a whole new set of worries, like we said, about, bullying and kind of, or worse, I've had this picture of what I thought your life would look like, and that's going to take me a second to reconcile it. It doesn't mean I don't love you. It doesn't mean I don't support you. I just need a second. Is that okay to say?
Absolutely. I was going to say, you don't want to sugarcoat things, and just, your child will be able to read some of your nonverbals. Yeah. And so you can lead with some honesty, and you're not going to harp on that and really unload your grief on them. That's not cool.
Right.
But certainly acknowledging that it's a journey and you're on that journey. You're not stagnant. You are trying to move. It's just going to take some time, I think is super understandable.
And I've worked with kids and their parents where whether the pronouns have changed or they want to go by a different name, and the parent, uses the old pronouns and the old name, but acknowledges it, apologizes for it, says, I'm trying. Yes. Most of the time, the kid will be like, I totally understand. It's a big change. You called me this name for 13 years, and now I'm saying call me this? Okay, I get it. But as long as, the parent doesn't, huff and puff about it or, roll their eyes when the kid corrects them, as long as they're like, I messed up. I apologize for messing up. The kid usually is like, thanks. I get it. At least they're trying.
Yeah. And I'm sure, that's, I would imagine, a big sort of adjustment for them too, because, we've talked to and followed people and highlighted people who are trans, and even they say it's a weird thing to admit to yourself. It's a weird truth to speak out loud, even if you don't speak it out loud. Yeah. In your own brain. It is a big thing. So I'm sure, to your point, they would be understanding as long as it is a little bit of self-awareness and oh, I'm sorry. I called you,
especially at the beginning,
Timmy, and now you're Jane, and I'm so sorry. But
And I think the trans community is so understanding in that respect and really appreciative of those efforts. And I think that's really important. And, as long as families are trying to kind of lower those rejecting behaviors and increase the accepting behaviors, and research does support that as well.
That actually kind of toes in nicely to a question I wanted to ask. And, we have touched on the damaging effects of maybe a negative or rejective presence in your life as a member of the LGBTQ community. What are some of the ways that a supportive family or friend presence can positively impact? Because I don't want to just dwell on the negatives. And maybe that's one thing in this prompt specifically, if they get to that point, she can say, these are things that will help them to grow and flourish. If they do end up being, I'm sure there are some that no matter what for your child, no matter what their orientation is, would still be helpful. But so what are some of the ways supportive can impact?
Yeah, so I think if we were talking about someone who has a transgender identity, you'd want to definitely think about shifting those pronouns, using the name that they are choosing to use, being respectful in those ways. Certainly starting discussions around what would be helpful for them in their social transition or depending on their age and their medical transition. So really having that dialogue with that young person about how can I support you feeling like you're going to lead your most authentic life. And I think it's hopefully going to go beyond just acceptance into how do we celebrate your identity? So do we, in the month of June, go to Pride events? Do we, watch movies about LGBTQ people? Do we, say nice complimentary things about celebrities who identify in the community? Just thinking about how do we introduce role models? How do we make it okay, that this is just a part of our world to have gender diversity or diversity in sexual orientation?
And I've seen a lot of times just acting quote unquote normal, regardless of what they're wearing, what name they're being called with outside people, that it's not even a flinch for the parent. It's oh, this is my child, right? Because that I think is the biggest way they can feel supported and loved if they're treated just the same as before and after.
Yeah. Okay. I am curious. So, and I'm sure there's maybe not as related to this prompt, but if there are parents listening or family members listening or friends listening even that think that a loved one might be gay, lesbian, trans, how do you let them tell you, or are there ways that you can kind of maybe subtly let them know that you are a safe space or you're someone that it would be okay to kind of speak that truth to? Or are there ways you can show your support without maybe necessarily having that conversation with them?
Yeah, so I think certainly conveying that you're an ally to the community. So certainly in our offices, there are rainbows everywhere. there are ways to send a message that I am cool with the population, regardless of whether I identify under that umbrella or not. Just, I think, being able to say complimentary things, not, saying the things that are in this scenario, for instance. So I think that says a lot. I think sort of the golden rule is generally you don't out someone else. So I wouldn't, encourage them to be aggressive in initiating a full-on conversation, but indeed setting that stage in a safe way.
I would agree. And I think that if you're accepting of your friend or whoever it is in other decisions they make in their life and you're not judgmental about those things, they might be like, okay, this person seems to love me and accept me for even like the dumb behavior I have. Like when I got too drunk at 15 and they had to like bring me home and they call me the next day and they're like, how you feeling? Instead of like, why'd you put me in that position, right? Like that kind of acceptance to be, okay, this person seems to have my back. So I think that I'm going to be able to tell them this.
And we do see more and more that teens are coming out to their families at younger ages. So certainly I think as a society, with certain exceptions, we're headed in a healthier direction, that teens feel safer. There are role models out there and, they're having those conversations.
And I even think, and even though I don't love it, but like TikTok, there's, people post videos of them coming out to their family and how nervous they are before and what they're gonna, I don't know how they're going to react, or I'm going to tell my siblings before I tell my parents. And it's such a welcoming and inviting and loving reaction that I think even just being able to see that can be like, all right, maybe it isn't going to be my family that goes the other way. Other people have done this really hard thing and they're my age and they look like me. They're not a celebrity. They're just like Joe that lives over there and like decided to tell his brothers. And the brothers were like, oh, okay.
That's cool.
Yeah. Thanks. Thanks for letting me know something you really didn't have to tell me like this. And he's like, oh, okay.
Yeah. I do kind of want to call out, and maybe TikTok's not going to make this list, but for both of you, what are some of your favorite resources for parents or, family members of LGBTQ youth and the young people themselves?
Sure. So the Trevor Project is something that I get on the radar of the young people themselves. So Trevor has a crisis hotline, there's chat lines, there's social media opportunities. So this is just a really great resource for the youth who might be feeling some really powerful feelings and might be dealing with some really dark thoughts and to keep them safe. So the Trevor Project, without a doubt. And honestly, if a teen has that website up and then they don't want a parent to know, like there's a quick little button they can hit and the website disappears really fast.
Oh, that's helpful.
So yes, they have really designed everything very thoughtfully to protect the teens and their safety. So the Trevor Project. I would also mention the Family Acceptance Project for families. That's where a lot of the discussion is around kind of increasing these behaviors of acceptance and decreasing the behaviors that are more rejecting in nature. So I would definitely point to that as a resource. PFLAG is a great organization for families, and there are PFLAG meetings here in Long Island, as well as, of course, in the city, in Westchester, and the other communities that Northwell serves. So PFLAG Long Island, I believe there's monthly meetings rotating between Suffolk and Nassau County. So I would definitely point them in that resource direction. For young people, I would encourage them to look out for Pride for Youth in the community, the GSA at their school, and so on.
And Pride for Youth there's the coffee house and
there's Coffee House on Fridays.
Yes.
There's Transaction, the trans identifying group. There's a lot of cool programs.
And that's Pride for Youth, right? I couldn't remember the name. I'm sitting here going, I know I've referred so many times. What is that name? Yeah,
they go more by PFY, so I kind of...
Okay, gotcha. And I know that like for Long Island base, there's also the Long Island Crisis Center. You can always call, and that's for any kind of issue. And the people will talk you through. It could be 2 a.m. I think they have chat now, text, and it allows teens to feel safe and be able to talk to somebody. They're trained counselors. They have names that they only, like, you'll never be able to know who you're really talking to.
Yeah.
But it's a great resource, if you just need to talk, and then they can give you resources too, right? Like, they're able to then outsource and say, maybe you need this, maybe you need that.
Mm-hmm. And can I plug our own Northwell services?
Of course you can.
Well?
Of course you can.
So across the street from where we are now at 410 Lakeville Road, we have our LGBTQ transgender program. So we have medical and mental health services on site. We're also connected to the surgery teams, the endo teams, all sorts of providers within Northwell who certainly help the LGBTQ population. Then there's the Friedman Center in Manhattan at Lenox, again, similar kind of model. There are resources in Westchester as well through Northwell. So just wanted to put in that little plug.
Yeah.
And I guess also I'll just mention real quick, I work with the young adult HIV program as well. So should there be interest in HIV prevention medication in the population, definitely keep in mind that our Center for Young Adult, Adolescent, and Pediatric HIV.
Okay. So at the end of every episode, we do a TLDR, which was included in this prompt. I've had a knack for picking a lot of them that have them, but it's short for too long, didn't read, if you didn't know. I've taught you something. You're welcome.
I didn't know the first time either.
And so maybe a TLDR for this one is, just because you maybe don't have biases in your external relationships, it doesn't mean you don't have them in your own home. And if you're dealing with someone, in say a husband, that does, approach it in a non-confrontational, not in the moment of it way, and try to just let them know how you feel about it, and then try to educate them specific to this context about the kind of damaging effects that the comments can have. And also remember, your children are sponges, and they can always hear and understand way more than what you think that they can.
And I would say it's never too early to intervene. So we're glad that this conversation is starting now while the kids are young.
Yeah.
Sounds good to me.
Yeah. Well, thank you, ladies. I will be sure to include all the resources that we've talked about and any kind of related links, as well as any links to how to contact both of you in our description below. And thank you for being here, and thank you for listening to Just Curious.
Thank you.
Thank you, and happy Pride Month.